Thanks. The plus was a generous acknowledgement that I'd somewhat over-prepared on the slides. I enjoyed that immensely. My presentation is, in a sense, a change of pace, and that I go back to what Rachel was talking about the quality of the evidence on which much of this work is based. So away from the extremely stressful presentation of Keir and the very effective cartoons, and sort of back into the process of research, of reviewing evidence and seeing its strength and the implications of that for the kind of work that we do. So, as an academic obviously starts their presentation with, we need more research, but the main advantage of this extremely systematic study is that we now have a much better sense of what we don't know, where the evidence gaps are, where the evidence is weak. So, I mean, to pick out a few examples, in relation to prevalence, Nicola points out in the report that there are some very well-known estimates of sexual and physical violence, but actually how these are generated, we don't really have a very clear sense. And similarly, in studying care, there's a strong bias towards middle-income countries and particular sectors such as orphans and vulnerable children. The evidence base on programme effectiveness is quite fragmented, as we'll discuss, and there's also this divide between those working on child poverty and protection, which events like these are intended to break down. So the methodology has already been discussed. It kicked off with an expert panel and a public event. And one of the reasons for this was partly to bring stakeholders on board, but also because actually 71% of the papers included in Rachel's review were grey literature. So this literature had to be found. They needed expert recommendations, hand searching of websites. There was then a very comprehensive review of literature, mostly drawing on papers from sociology and public health, and electronic and email surveys. So many of you won't engage with either the background note, which is still quite long, or the extremely impressive report they published from the first phase. So this is just a summary to give you a sense of how meticulously the evidence was reviewed. They did a systematic review, as Rachel said, of 83 studies of 71 programmes using a mixed methods assessment tool that doesn't place undue weight on particular types of evidence, but is therefore very good for engaging with grey literature. But as Rachel was describing, 55% of the papers that they identified had to be excluded because it wasn't clear from the way the methodology had been described what had actually been done. Of those that were included, less than 10% scored the top score for evidence on the MIMAT scale, and the majority of them only just made it over the exclusion threshold. And I think this is quite an important point around the quality of the evidence that we have to work with and the need to generate these. And Rachel draws out some quite simple ways in her longer report that this can be done. So Keir's discussed the primary research in Ethiopia, also in Vietnam and Uganda, but I won't cover this. So focusing particularly on the systematic reviews of programmes, one of the problems was that there were a number of different categories they looked at, as you'll recall, but there were few studies in each category, maybe only 9 or 10. So it was quite hard to draw conclusions around the effectiveness of different types of programming. The majority of these were small scale, mostly implemented by NGOs. There were some examples of large scale programmes such as conditional cash transfers or parental education, but in these cases the evidence base for impact was not always strong. This is particularly the case for the child protection system strengthening, or child protection where you had something that was predominantly social protection. Child protection outcomes had not been monitored, so it was quite difficult to draw any conclusions. As Rachel said, about 43% of the interventions had an economic strengthening component. But this varied greatly according to the type of programme, so we're already starting to see some problems here in accumulating an evidence base which might direct us in future programming. Lots of interesting examples, but they're quite individual, particular combinations of elements in particular contexts, and it's quite difficult sometimes to draw out the mechanisms which make these projects work and which might make them work or not work effectively at a larger scale or translated to different contexts. So you might have got a more favourable impression of, for example, the extent to which theories of change were incorporated from the synthesis that Rachel presented, but I think these are your own ideas developed through the synthesis. It's not that there were clear pathways of change outlined in the documents that you were reviewing. So that's obviously a slight problem in looking at mechanisms. And she also observed poor use of monitoring and evaluation data, which can often be the foundation for good impact evaluation. For example, an anti-trafficking intervention in West Africa, which systematically collected databases of M&E data, which they then didn't use in evaluating their programmes. So this feels like a wasted opportunity, and we've already talked about the way in which monitoring data might need to widen to include outcomes specific to child protection. Some broader considerations are the complexity of these studies. They're very resource intensive. Many of them almost work on a kind of Millennium Villages model where every kind of intervention is thrown at a particular target group, but it's quite difficult then to separate out the effects of different components. So questions that you might want to ask is, can these programs be streamlined before scaling them up? I mean, basically, is there anything you could take out and the program will still work well? Do we actually know what it is about the programs, which are the key components that are working, or the key ways in which components work together with other contextual factors? Do we understand the cumulative effect of different components? So Aroka gives a very good example of microcredit in Kenya, that without intensive mentoring and social support, girls were not able to make good use of the microcredit component. We also noted that there are few interventions designed with a control group, which is, there is a debate obviously about whether RCTs are really the gold standard, and I tend to feel that they're not, but I can see that having a control group can be very useful in demonstrating value. And there was also insufficient data to do any kind of cost-benefit analysis with most of the interventions reviewed. And then, of course, finally, few interventions capture the sustainability of impact. 1 year on, maybe things look quite good, but 5 years on, 10 years on, what effects have these had on girls' and women's lives? So perhaps an even more worrying gap is the lack of study of differential effects on different groups. So much of the monitoring data wasn't disaggregated by socioeconomic status. And few papers also explicitly discussed who benefits. There was a sort of assumption that benefit was evenly distributed, but we know from our own experiences that that's rarely the case. I've talked about the lack of systematic analyses of why these programs work well or how they could work better. And there's also some limited evidence on the pathways by which they actually worked. So the question about the role of the justice system, which is quite an important component in many of the programs, but it's not entirely clear what you need in addition to that to make it work well. It seems to point towards the time for test and learn, which Nicola Jones and Angus Deaton have simultaneously argued that actually there needs to be some more flexibility for experimentation and learning through experimentation, which often isn't there because there's the pressure to scale up successful projects, perhaps before you have a full understanding of exactly why they are successful. So I am moving to concluding questions. Something that was quite interesting, but I didn't think you could come to a clear conclusion on that, is whether there was a difference between types of programs studied and the quality of their methodological accounts. I mean, whether, for example, child marriage programs tend to be evaluated with more rigorous methodologies and have a much fuller account of what was actually done. These are obviously extremely sensitive areas to research and evaluate, as DFID's finding with their Violence Against Women and Girls programme. But I would argue that even where you're working with small samples, this shouldn't necessarily mean reductions in rigour. And one way of improving rigour would be to bring in monitoring and evaluation data, and perhaps strengthen the capacity of organisations to generate good data that can then be used in comparable studies and these kinds of reviews. Substantively, there were also a number of evidence gaps, which Rachel has touched on, relating to trafficking. This is not that there are not studies of trafficking, but the studies are methodologically so poor it's hard to draw any conclusions. Sexual exploitation of boys, the impact of cash transfer programmes on child protection, this sort of social protection, child protection divide, and the complete absence of integrated social and child protection programmes. And then, of course, the final question is where it is possible to scale up. What's the political economy of that? What are the factors that enable programmes to be successfully scaled up? Where do you find the will? Why, for example, was the Ethiopian government suddenly prompted to stop international migration? What was behind that? So a better understanding, perhaps, of the role of advocacy organisations in making these decisions is very important. And this kind of work is being done in other fields using methodologies such as process tracing. So I think that's all I would say, except congratulations for a very systematic and sustained study.
Thank you very much, Laura.